You have an appointment with us? Okay. Give me one moment. I apologize. All right, and what was the last name? Can you spell that for me, please? Okay. And which dentist were you seeing today? Okay, perfect. So it actually looks like I'm going to be your dental hygienist for today. I promise you are in safe hands. I noticed that you are a new client here. So welcome first off. And before we start, I just want to get a little bit of information that I see was not completed on your new client intake form, if that's okay. Okay. So could you please confirm the spelling of your first name for me? Perfect. And then the middle initial. Yep, okay. And then could you please provide me your home address? Did you say east or west? Okay. And then could you give me, please, your date of birth? Month, date, year. Okay. The 23rd, you said? Great. It's coming up. Happy almost birthday. Okay. Perfect. And then are you currently on any medication? Okay. I believe I'm familiar with that. And then what is the dosage you take? Yeah, milligrams, okay. And then your primary caregiver or primary physician. Okay, perfect. And then just in case of any emergencies, which shouldn't arise, but in the unlikely chance something happens and we need to contact someone, can I please get a name and telephone number for that emergency contact? Can you spell that, please? Okay, thank you. Perfect. All right. Let's see if everything's here. Oh, and then can you just confirm your insurance provider? Okay, perfect. Yes, we do take that health insurance. Okay. So everything looks all good in the system. And again, welcome. We are excited to clean your teeth. And as I said, I will be your dental hygienist today before the dentist comes in. So I am going to first be examining your teeth and just making sure and noting if there's any imperfections or anything that might be troublesome to alert the dentist for. Okay. So if you just want to have a seat right over there in the waiting room, I will get the room set up and then I will call you back as soon as we are ready for you, okay? All right, see you in a bit. All right, well, thank you for your patience. As you can see, the room is now all set up. Are you comfortable in the chair? Do you need me to raise it, lower it, anything, tilt it? No? Okay. Well, I just want to go through a few things before we get started, as you are a new client. So just to give you a rundown of everything, I'm first going to be just going through a couple goodies that we have for you in terms of just toothbrush, toothpaste, just a couple things that we have for you to take with you today to help keep your oral hygiene going. So once I finish going through the items, I am then going to mask up, glove up, sanitize, and make sure your teeth look good. I am not going to be doing the cleaning today. I'm going to leave that to the dentist. But I do want to examine your teeth briefly, go through all the teeth, and see if there's anything that we need to note in your file or note for the dentist to look at. Have you had any discomfort that we need to know of, or anything that just in general with your oral hygiene that we should have in our system? No? Okay, so you're just here for a regular checkup. Perfect, okay. So again, before I look into your mouth, I'm just going to quickly go through the bag we have for you. So, this is the bag that you will take home with you today. And in it, we have the typical items that you would use to keep your mouth in healthy shape, as well as your teeth and your gums. Now I know a lot of the times dentist offices give these away at the end of appointments, but we like to make sure our clients and patients are educated before they leave in case they have any questions when they get home. Just a way to make sure you know what to do with everything, although I'm sure you do. So the first item is a toothbrush. Now, I'm sure you have used a toothbrush before, so I will be brief. But this is just a standard Oral-B toothbrush. And it is the #1 brand that's recommended by dentists. So we stand by the product when we give it to our patients. And just as a quick care note, this only is meant to last, and it does say on the back, about 3 months. So make sure that you are replacing the toothbrush in about 3 months or so. So, along with the toothbrush, we have some toothpaste. Now this is Colgate Optic White. And this is going to be a stain-fighting toothpaste. It polishes, it removes 6 times the surface stains, and it is safe on your enamel. And now, I don't know about you, but I am a fan of mint toothpaste. So this is a nice fresh mint flavor. So if you don't know, you're supposed to brush your teeth twice a day. Not once, but twice a day at least. And so what you do with the toothpaste is you should put about a pea, that's a large pea, a pea-size amount on your toothbrush before brushing for about 2 minutes. too much is a waste. Oftentimes when you spit, there are clumps of the toothpaste that come out, so it's wasteful to use too much, but too little is not going to effectively clean your teeth. So that is the basics in terms of brushing your teeth. What I also have is some dental floss, Colgate of course, and some threaders. I noticed that you have some wires in the back of your mouth from orthodontian work. So what these flossers do is they're almost like a loop, a small wire loop. And what you do is you will take the dental floss, small amount, and you're going to put it through the loop. And what this does is you are going to weave it through your teeth, and it allows it to get between the wire so you can floss. It is a great and safe way to get into the teeth that are blocked by wires and other metal and orthodontian products. So that's that. And something I forgot to mention is you should also be flossing at least once a day to keep your gums nice and healthy and avoid any bleeding or irritation or gum disease. Okay, so this is what you're going to take home again. And I'm just going to put this over to the side, and you will get it before you leave today. Alright, so are you still comfortable? Okay, good. So what we're going to do next, before the dentist comes in and we clean your teeth, is I'm just going to briefly examine them. Is it alright if I get close and in your space before we begin? Okay, perfect. So, I'm first going to put on some latex gloves. I am sure you do not want my bare hands in your mouth, and frankly, I don't want to put my bare hands in your mouth. So, this is a way to keep us both safe. And I'm also going to put on a mask just to make sure that there's a barrier between my mouth and just kind of getting into your space. You don't want me breathing into your mouth, I'm sure. Okay, so. Alright, so I hope you can still hear me. What we're going to do is, as I stated, I'm just going to look into your mouth. Nothing crazy. I'm just going to kind of have you open, kind of take a look around, and then just make any notes that are necessary, okay? Alright, so if you could just open wide. Perfect, thank you. I'm just going to get in here. Okay, let's see. Tilt a little down, please. Perfect. Okay. Let's see here. Looks good so far. Not seeing anything crazy out of the normal. Okay. Have you had any cavities prior to today? You had one filling. Okay. I'll make a note of that after. Do you mind telling me which tooth it is or about the area? Okay, there it is. Okay. Looks like an old filling. It's pretty worn down. Have you had it refilled since? No. Okay. Just curious. All right, and then I'm just gonna get up into these top teeth. Okay. Let's see here. Do you have any work on your top teeth? I'm noticing a little. Yeah. Okay, so you know that it's a little chipped back there. Okay. And has any dentist previously told you anything about it? Suggesting any filing, any filling, anything to fix it? No, okay. I'm just curious. Okay. Let's see. Okay. Looks good there. And are you having any discomfort as I'm kind of poking around? Anything in the gums? Any sensitive teeth? This one? And this one over here? I'm gonna touch it gently. Just let me know. Yeah, okay. A little discomfort. Okay. Let me just do one more quick sweep. All right. I'm going to take off my mask. Okay. I'm just gonna remove my gloves. You can close your mouth now. I'm just going to make a few notes here. So you had mentioned the prior filling, and I just want to make a note in your record for the dentist to look at that. I don't know if it necessarily needs to be filled today at least, but it is something we want to keep an eye on because fillings over time naturally wear down. So we don't want to leave the tooth exposed. And then I'm also going to make a note of the chipped tooth as well, just again so he can look at it. Is it causing you any discomfort? Okay, no, okay. I'll make a note of that. If it's not causing any problems, I don't imagine we're going to have to do anything with it today. Again, just something to note over time with subsequent appointments. Yeah, monitoring teeth is very important. If you have a problem, even if it's not bad today, it could flare up in the future, so we want to make sure we have a note of it, so next appointment we can look, follow up, etc. And then you said that your back molar was a little sensitive. Okay. Can you open and just tilt? I won't get too close. I'm not seeing any like wear down or a specific sign of a cavity. It could be some gum issue, some sensitivity there. That toothpaste that I have in the bag for you is good for fighting gum sensitivity. So I would recommend trying that tonight when you get home and then keeping up with it unless it causes discomfort from use. Okay. All right. So it looks like we're all set here. I'm going to go grab the dentist and bring him in unless you have any questions for me. Okay, well, again, welcome to our practice. You are in great hands here, and I will see you when you check out, and then in hopefully the next 5 to 6 months. All right? All right. I'm gonna go get the dentist, and we'll be right back.